So recalling that conversation we had recently, there are many advantages to a science-based study in order to get to the truth of knowledge so that we can apply it to our patients and help them with their health concerns. And that is in response to 2 centuries ago when that was not highly available to us in the study of human ailments and conditions. And so we've been able to eradicate a lot of false beliefs by getting to good scientific studies. There are limits to science, however. Some of them are just practical. For example, they'll do a study on a particular pharmaceutical agent and find that it's effective for a certain condition. But there are very few scientific studies in which 2 drugs are studied simultaneously, or 3 studies are studies where there's 3 drugs or even more. So there is no scientific basis for the use of those. There are clinical observations, which leads us to other forms of knowledge that we can use in order to help our patients. And actually in the day-to-day practice of helping patients, we use so much more than just strict scientific information. It's very difficult to isolate variables when you're talking about various nutritional programs, for example. The length of a scientific study, if you look at a lot of these, they're only 6 months to 6 years. It's very difficult to do scientific studies that are going to be lasting for a generation, for example, to get that effect of a particular introduction of a healing technique. So while it's very helpful to have that scientific information, in terms of actual practicality, a lot of physicians actually will use their personal experience, things that they have seen work on patients, so they'll use those. Cultural information, anthropological information that don't fall within the context of that scientific modality of study, but still has a history of being helpful. And that can be very useful and is very useful on the day-to-day practice of actually helping patients. So there's intuition, there is palpation. There are so many other ways outside of just laboratory tests and Petri tests or x-rays in which you can gain information that, in fact, you'll even see, like on an x-ray test or a lab test, correlate with clinical studies. You actually are looking for collaboration of information. So I would say the scientific evidence relative to treatment is very helpful, but I also have to suggest that there are people who will not, physicians who will not use certain kind of information, even though there's a lot of anecdotal support for the use of a nutritional supplement, for example, and helpful for a certain condition. And I have to ask them, well, where's your scientific evidence to refute it? There are no scientific studies for your opinion that it doesn't work. So they kind of go on this, well, you have to prove it first, it's false until it's proven. And where does that assumption come from? Where's that hypothesis in the use of actually helping people with their conditions? So I find that a lot of their arguments are in and of themselves non-scientific. There is no scientific study to show that it doesn't work. So my argument to them is, well, then that's your opinion, right? It's not based on science. Because I have a lot of anecdotal helping of patients where there's no side effects, it's very low cost, people get better, and to suggest that you can't use that because it's not scientific, I don't think is in the best interest of the patients. So I think a more holistic use of scientific evidence and also practical information. I think of the 8 forms of emotional intelligence. There's a lot of ways we can access knowledge and do no harm and help the patient. That's what it comes down to.